Culturally sensitive therapy, also known as culturally competent or culturally responsive therapy, is a therapeutic approach that recognizes and values the importance of culture, ethnicity, race, and other cultural factors in the therapeutic process. This approach acknowledges that individuals from diverse cultural backgrounds may have unique experiences, beliefs, and values that impact their mental health and well-being. Culturally sensitive therapy aims to provide a safe and inclusive space for clients to explore their concerns while honoring their cultural identities and backgrounds. Key principles of culturally sensitive therapy. Culturally sensitive therapy is guided by several key principles that shape the therapeutic process. Cultural awareness. Therapists practicing culturally sensitive therapy must possess cultural awareness and humility. This involves recognizing their own biases and limitations while continually educating themselves about the cultures they encounter. Respect and validation. Therapists demonstrate respect for clients' cultural identities and validate their experiences. They acknowledge that cultural differences can influence how individuals perceive and cope with mental health challenges. Cultural competence. Therapists strive to become culturally competent, which means they develop the knowledge, skills, and attitudes necessary to work effectively with clients from diverse backgrounds. Intersectionality. Culturally sensitive therapy acknowledges that individuals possess multiple intersecting identities, such as race, gender, sexual orientation, and socioeconomic status. These identities can influence their experiences and mental health needs. Collaboration. Therapists collaborate with clients to incorporate cultural factors into the therapeutic process. Clients are viewed as experts on their own experiences, and their input is valued in treatment planning. Cultural adaptation. Therapists may adapt their therapeutic approaches to align with the cultural preferences and needs of their clients. This may involve incorporating culturally relevant interventions or modifying treatment modalities. Practices and approaches in culturally sensitive therapy. Culturally sensitive therapy encompasses a variety of practices and approaches, including 1. Cultural assessments. Therapists conduct cultural assessments to understand how clients' cultural background may impact their mental health. This includes exploring cultural beliefs, values, traditions, and family dynamics. 2. Cultural formulation. Therapists use cultural formulation to integrate cultural factors into diagnostic assessments and treatment plans. This approach ensures that cultural context is considered when addressing mental health concerns. 3. Language consideration. When language barriers exist, therapists may use interpreters or provide therapy in the client's preferred language to enhance communication and comprehension. 4. Cultural psychoeducation. Clients may receive psychoeducation about their own culture and its influence on mental health. This can help clients gain insights into their experiences and coping strategies. 5. Cultural adapted interventions. Therapists may modify evidence-based interventions to better align with the cultural values and beliefs of the client. This ensures that therapy is culturally relevant and effective. The benefits of culturally sensitive therapy. Culturally sensitive therapy offers several benefits to clients and the therapeutic process. 1. Improved engagement. Clients are more likely to engage in therapy when they feel understood and respected in the context of their cultural identities. 2. Enhanced communication. By addressing cultural factors, therapy can facilitate more effective communication between the therapist and client. 3. Increase effectiveness. Culturally sensitive therapy is more likely to yield positive outcomes because it considers the unique needs and experiences of the client. 4. Reduce stigma. Clients from culturally diverse backgrounds may face stigma related to mental health. Culturally sensitive therapy can reduce stigma by normalizing discussions about mental well-being. 5. Cultural empowerment. Clients may gain a greater sense of empowerment and self-efficacy as they explore how their cultural background can be a source of strength and resilience. Challenges and considerations. Culturally sensitive therapy is not without its challenges and considerations. Cultural competence. Therapists must continually invest in developing cultural competence, which requires ongoing education and self-reflection. Diversity within cultures. It's important to recognize that individuals within the same cultural group may have diverse experiences and beliefs. Therapists should avoid making assumptions based solely on cultural background. Intersectionality. Clients may possess multiple intersecting identities that influence their experiences. Therapists must consider these intersecting factors in their approach. Language barriers. Addressing language barriers effectively can be challenging, but it is crucial for ensuring effective communication. Ethical considerations. Therapists must navigate ethical dilemmas related to confidentiality, cultural sensitivity, and client autonomy. Conclusion. Culturally sensitive therapy is an essential approach for mental health professionals working with diverse client populations. By acknowledging the influence of culture on mental health and adopting culturally sensitive practices, therapists can create an inclusive and empowering therapeutic environment. This approach not only improves client engagement and outcomes, but also fosters a deeper understanding of the complex interplay between culture and mental well-being. Ultimately, culturally sensitive therapy contributes to the promotion of mental health equity and the recognition of the rich tapestry of human diversity. We are House of Thought Therapy, nurturing minds, empowering lives.